Hi, my name's Samantha Hughes. I'm a student with Maryville University, and today I'm going to do my head-to-toe assessment on Clarissa. Before Clarissa came in, I asked her to empty her bladder and put on a gown, which she's done, and now we're going to obtain vital signs and height and weight. We'll start with height and weight, so if you'll stand on this scale there for me, Clarissa. All right, thank you, 166, and then we'll get your height here. You'll hold that for me. She is 62 centimeters tall, inches tall, 62 inches. Go ahead and have a seat for me. All right, we'll get your signs here. Sorry. All right. .114 over 66. I'm going to get your pulse. Your pulse is 66 and your respirations are 18. And we're going to go ahead and get your temperature. Under your tongue for me, please. Thank you. Okay, 98.6. All right, so vitals have been obtained, and what I could do now is also check her distance vision using the Snellen chart, or her near vision using the Rosenbaum chart, and that would be optic nerve number 2, or cranial nerves number 2 optic. Now I'm going to look at Clarissa's head and her face. I'm going to make sure, see that her head is symmetrical. It's resting atop her shoulders and her neck. Her head is normocephalic. I'm going to go ahead and look to see that her eyes are symmetric, her ears are symmetric on her face. As I look at her head, I'm going to palpate. I don't feel any lumps, no depressions, no masses. Her hair is evenly distributed. It does not appear as though it's fallen out at the follicles. It's nice and smooth and clean. The next thing I'll do is I will look at her face and go ahead and palpate her facial bones. No tenderness when I do this, right?
No.
Good. I'm also going to palpate her sinuses. Any tenderness here? And this is her frontal sinuses and her maxillary sinuses. Any pain or tenderness there?
No.
Good. I'm also right now going to check her temporal mandibular joint. So go ahead and open up your mouth for me a couple times. And put your mouth side to side for me. There you go, good. And any tenderness when you do that?
No.
I'm assessing for tenderness and any feeling for any snaps, pops, clicks, and I don't feel any at this time. So what I'm also going to try is I'm going to check her cranial nerve number 5, the trigeminal nerve, for light sensation. If you'll close your eyes for me and tell me when you're feeling, or where you're feeling this out on your face.
My forehead, right cheek, left cheek, and chin.
Good. And the next thing we're going to do is check for your cranial nerve 7, your facial. And I need you to do a couple exercises for me. You're going to wrinkle your forehead for me. Good. Smile real big. And clench your teeth together. Good. Puff out your cheeks. And stick out your tongue for me. Very good. All right, so after we do that, now I'm going to look at her eyes. I'm looking at her eyebrows, making sure that they're symmetric. The hair distribution is symmetric on both eyes across. Both eyes have eyelashes, and they are also symmetric. Hair distribution is even bilaterally, and the eyelashes are going away from the globe, which is normal. I'm going to have you close your eyes real tight for me. Good, and open them back up. Any discomfort when you do that? No. Go ahead and close for a second. Any discomfort when I palpate here?
No.
Okay. Open them up. The lacrimal apparatus is palpated. There's no extra exudate, no discomfort or tenderness when I palpate there. At this point, I'm going to check her pupils for direct and consensual response. If you'll look at a point in the distance for me and look straight ahead. Direct and consensual. Direct and consensual response. Very good. The next thing I'm going to do is I'm going to check her 6 fields of cardinal fields of gaze. So if you'll just follow the end of this for me, and we're going to just follow it with your eyes and not your head. And the convergence. Very good. All right, and that's appropriate. The next thing we're going to do is the cover-uncover test, and she's going to put this piece of paper in front of her left eye for me. And you're going to look at a distant or an object in the distance for me and remove the cover. Good, and go ahead and do that to the other eye. And remove the cover. Good, and that's a normal test. Her eyes are fixed straight ahead, and there's no strabismus noted. So the next thing we're going to do is I'm going to check her her red reflex. Excuse me. All right, look straight ahead for me. And I see her red reflex in her left eye. Good, and I see it in her right eye as well. So I'm going to check peripheral vision next, and she's going to look straight ahead for me. I'm going to stand behind her. And if you'll just tell me when you can see my fingers, okay?
Mm-hmm. I see them. It's now. Now. Now.
Good. And that those tests are testing cranial nerves 3, 4, and 6, the ocular motor, the trochlear, and the abducens. All right, so after we've done the eyes, we're going to look at the nose, and I'm going to make sure that it's symmetric, and then I'm going to palpate it. No tenderness when I do that, is there? No. Okay. If you could, for me, look up. I'm going to look in your nose here for a second. Good. Mucosa is pink. The turbinates are not swollen on either side. They're fine bilaterally. While I'm looking, I'm just going to look in your eyes real quick at the conjunctiva and the sclera real quick. Go ahead and look up for me. Good. Good. And the sclera is white and the conjunctiva is pink and moist, which is normal. So now what I would like for you to do, Clarissa, is if you could occlude one nostril for me and breathe in and out of the other one. Good, and then do the same to the other. Good, all right. And both nares are patent, so that's good. At this point, we could check her smell if we had an issue or think that she had some difficulty smelling, and that would be cranial nerve 1, the olfactory nerve. The next thing we're going to do is we're going to look at her ears. And the first thing I'm going to do is I'm just going to look at them outside or externally, make sure that they're symmetric bilaterally, and they are. Make sure that her auricles are the same color as her skin, which they are. There's no masses, no lesions noted to either side. Any tenderness when I feel or palpate your pendant or your auricle? Good. What about this side? Good. No?
No.
And they're both non-tender and they're mobile, which is normal. I'm going to look in the external ear. There's no obvious drainage noted to either side. And then now we're going to go ahead and look at her ears. Good. Her tympanic membrane is a pearly gray. There is no redness noted to the canal, no seruma noted as well. Good. And again, there's no redness noted in that canal either. The tympanic membrane is pearly gray in color. No irritation, no seruma noted either in that ear. Excuse me. The next thing I'm going to do is I'm going to check for any hearing loss that Clarissa might have. And the first thing I'm going to do is the whisper test. I'm going to go behind you. What I need you to do is cover your left ear for me. And I'm going to whisper a word behind you, and if you can tell me what that word is.
Apple.
Good. And do the same with your other ear.
Baseball.
Good. The next test we're going to do is called the Weber test. I'm going to take the tuning fork and strike it. I'm going to put it on the top of your forehead, and I want you to tell me where you can hear it, okay?
In both ears.
Good. And that's a normal finding. We do want to hear it in both ears. The next thing I'm going to do is I'm going to strike this again. I'm going to put it behind your ear, okay? On your mastoid. What I want you to tell me is when you cannot hear it any longer. And when you can't, I'll put it beside your ear. And again, just tell me when you can't hear it any longer, okay?
Now. Now.
Good. And we're going to do that to the other side as well.
Now. Now.
Good. And that's a normal finding in both ears. We want air conduction to be longer than bone conduction, and it was, so that's good. So the next thing we're going to do is we're going to look at Clarissa's mouth. And first of all, what I'm going to do is just have you open up your mouth. I'm just going to look around here. Your buccal mucosa looks pink and it's moist. I'm also looking at your teeth. They're all intact. It appears to be all there. There's no loose or missing teeth, doesn't appear. Go and close your mouth. There's no obvious dental caries noted. Go ahead and stick out your tongue for me. Good. Lift your tongue up. And I'm looking at the bottom side. The ventral side is smooth. Go ahead and close your mouth again for me. There is the frenulum is there. Go ahead and open up your mouth for me and stick out your tongue. Say ah.
Ah.
Good. Her uvula does rise. It's midline. Her tonsils are noted. They're not swollen. Anterior, posterior pillars are there. They're intact. No redness noted to those as well. Go ahead and open your mouth one more time for me.
Ah.
Say ah.
Ah.
Good. Good. All right. One more time. I'm sorry, Clarissa. We're going to try and elicit a gag reflex from you real quick here. Oh, sorry. And you do have one. Sorry. All right. And that's we're testing cranial nerve. For the 9 and 10 is the biggest in hypoglossal or glossopharyngeal rather, and we're also going to test the swallowing, and that'll be and the sticking out the tongue, what she's done. So go and do that again for me. That's thank you. And that's midline, and that's cranial nerve 12 that we're testing, and not the hypoglossal. All right. So I'm going to go ahead and look at your neck next. I'm making sure that it's symmetric. The musculature is symmetric. What I'm going to do now is check for, there's no obvious goiters noted, there's no masses that I see. I'm going to palpate your lymph nodes. I'm going to start back here with the occipital lymph nodes, the postauricular, the preauricular, the tonsillar, the submandibular, the submental. Any tenderness there? None felt, which is good. The superficial cervical, any discomfort? No. The posterior cervical. And go ahead and look towards me. And the deep cervical. And look the other way. Good. All right, you can look straight ahead. The supraclavicular and the infraclavicular. And I'm also going to palpate the axillary. Under the arm here. Good. And no lymph nodes fell, which is good. I'm also going to look to make sure her trachea is midline. I'm gonna feel that. Good. And while she's sitting here, there's no obvious JVD noted, jugular venous distension. Do you think you'd be able to swallow if I felt your thyroid real quick? All right, so I'm just gonna stand behind you and I'm gonna feel for where your thyroid is here and go ahead and swallow for me. Good, and it moves freely, which is good. All right, let's see. So what I'm gonna have you do now is I'm gonna have you turn around so I can look at your back. Please. Thanks. I'm just gonna untie the top here. Okay, so I'm going to be looking at Clarissa's back. I'm inspecting for any rashes, any lesions, anything that is not symmetric. Everything looks symmetric at this point. There's no obvious lesions or masses noted. I'm watching the rise and fall as she's taking her respirations. They're equal. There's no labored breathing or use of accessory muscles that I can see. So the next thing I'm going to do is I'm going to percuss. Okay, good. And I'm going to palpate down here at the 10th rib, and I'm going to do for thoracic expansion. If you go ahead and take a deep breath for me, Clarissa, in and out. Good. And it's symmetric bilaterally, so that's good. So the next thing I'm going to do is I'm going to measure for diaphragmatic excursion. So if you will, go perfect. Go ahead and forward just a little bit. And I'm going to palpate this. Go ahead and take a deep breath for me and hold it. And you can breathe. Okay. And go ahead and take a deep breath again for me and blow it out. Go ahead and breathe. Good. And I'm going to go ahead and measure this, and this should be between 3 and 6 centimeters. And she is at 5, so that's good. All right, so while I'm back here, I'm going to go ahead and auscultate. I'm sorry. Deep breath for me. I'm trying to keep you covered up back here. I'm gonna, at the costovertebral angle, I'm gonna go ahead and palpate or percuss for some tenderness or to see if there is any tenderness. So Clarissa, go ahead and tell me if there's any tenderness when we do that. No? And what about over here? Good. And then the other thing I'm gonna do real quick while I'm back here is tactile fremitus. I'm going to ask Clarissa to say 99, and I'm gonna see if I can feel it equally throughout her back. Go ahead and say 99.
99. 99. 99.
Good. Okay. All right. Go ahead and put that back on for me. Get you covered up here. Sorry. All right. All right, so now we're going to look at the anterior side of Clarissa, and the anterior posterior is less than the lateral, which is normal, which indicates that she doesn't have a barrel chest. Excuse me. So what I'm going to do is I'm going to auscultate, or I'm going to inspect the anterior chest, and I'm going to look, make sure there's equal rise and fall. There's no obvious labor breathing, any retractions, no accessory muscle use being are noted right now. So I'm going to go ahead and I'm going to percuss. And thanks. All right. And then I'm going to, now my respiratory focus, I'm going to go ahead and I'm going to listen to her lungs, anterior. Deep breath. And then I'm also going to check for tactile fremitus in the front. Again, you're going to say 99 for me. Sorry, my hands are not that warm. Say 99.
99. 99. 99. 99.
Good. Okay. And so I'm also going to check for thoracic expansion on the front as well. So I'm going to put my hands right here. Sorry, they're cold. Go ahead and take a deep breath for me, in and out. Good. Very good. And it's equal bilaterally, which is good and symmetric. Okay. While I'm here, I'm going to switch now to my cardiac focus. And I'm going to, first I'm going to just see if I can feel for the apicals. I'm just going to see if I can feel here. Okay. And I can feel the apical pulse, and now I'm going to go ahead and I'm going to listen to her heart sounds. I'm going to listen with the diaphragm first and then the bell. Aortic, pulmonic, herbs, tricuspid. Bicuspid, and again with the bell. Aortic, pulmonic, herbs, tricuspid, and the mitral. And there's no murmurs noted in any of those sounds or any of those feels. So the next thing I'm going to have you do, Clarissa, is lay down for me. Okay. And I'm going to look at your abdomen. I'm going to inspect your abdomen. I'm going to look. I don't see any masses, no pulsations. I'm looking. I don't see any obvious pulsations, any heaves noted when I look down at your abdomen. So the next thing I'm going to do is I'm going to auscultate in all four quadrants. And while I'm here, I'm going to go ahead and listen to the aortic, renal, iliac, and femoral arteries as well for any bruit. With the bell. Aorta. Renal. Iliac. And femoral. And there's no brewing noted. Her umbilicus is inverted, which is also normal finding. Now I'm going to do some light palpation. Sorry. Any discomfort when I feel that? Any palpation, any discomfort? Good. And then now I'm going to do some deep palpation to include the liver. Go ahead and take a deep breath in and out for me, Clarissa. Good. All right. And I can feel the border of the liver when she does that. And then I'm going to do the same thing over here with her spleen. Breath in and out. Right, I'm going to feel for any kidneys on the left kidney and the right kidney using bimanual palpation. And I'm not able to palpate those at the moment, or the spleen, which means that it's not enlarged. I'm also going to feel for the aorta, see if I can feel it pulsating or the pulse. And I can. Let's see. Okay. All right. Oh, I get some pen. Okay. Before I have her sit up and check her extremities, I'm going to measure the liver borders. So, I got my pen because I don't have any tape. All right. So I'm going to go ahead and palpate down. And then I'm going to approve that. And I'm going to measure this. And it should be between 6 and 12, and it's at 7.5, which is normal. Doesn't mean that it's inflamed. It's good. Okay. So now I'm going to have Clarissa go ahead and sit up. Cover up here. All right. So the next thing we're going to do is I'm going to look at her upper extremities. I'm going to tie that, or is that okay? Go ahead and put your arms out here for me. I'm looking at the length, and they're equal in length. I'm looking at the musculature, and they're even bilateral or symmetrical in the muscle. And there is hair distribution equally on both upper extremities. And I'm going to ask you just to relax for a second. I'm going to feel your radial pulse here. And your brachial. I'm also going to look at her fingers, and I'm going to look at her nails and see that they're pink. The nail beds are hard and they're firm. I'm going to look for clubbing with her fingers together. I don't see any obvious clubbing noted. And I'm going to check for capillary refill. And it's less than 3 seconds. I'm going to do it on this side too. And it's less than 3 seconds on that as well. Of course, I'm just going to check for a little bit of strength in your upper extremities. If you could go ahead and hold your arms out for me, and now push down. Good. And now push up. Good. And then try and bring your arms up towards you. There you go. Good. And then push away. Good. Just relax those arms. And now I'm going to look at her lower extremities. I'm going to fix the camera for you a little, so you can see her lower extremities. All right. Again, I'm going to look at her lower extremities, and I'm going to see that they're equal, they're symmetric as far as the musculature goes. They're warm, they're dry. Hair distribution would appear to be normal. I can't check her capillary refill on her toes because her toenails are painted, but if I did it on her skin, 1, 2, 1,000, so it's less than 3. 1,000, 2, 1,000. It's less than 3. I'm going to check her pulses, her dorsalis pedis. And it's there. That's good. And the posterior tibial pulse. Good. And her popliteals. Good. Good. Okay. And then just push out with your legs for me. Good. And pull back. Good. All right. I'm going to also check reflexes, and we'll start down here since the camera's already down here. I'm going to do her knee with patellar reflex. Just relax your round legs for me. Good. And then on the Achilles, just relax your hand in my foot here, or your foot in my hand here. Good. Good. And let me bring this back up a little for you. Okay. And then I'm also going to check her brachioradial reflex here. Good. Good. And those are present and good. All right, so let's see. The next thing I'm going to do is I'm going to have you stand up so that I can look at your spine, which I'll cover it up here. All right. I'm going to look at her neck, and I'm going to note that the curvature of her spine is normal, concaving in the cervical and lumbar, and convexing in the thoracic, and her spine is straight. There's no skeletal deformities noted. There's no discomfort, is there, down your spine here?
No.
Good. There's no curvature noted as well, or either. I'm going to have you go ahead and lean forward a little bit for me. Good. And I don't see any curvature, scoliosis, kyphosis. Her spine is straight. Go ahead and stand up for me, and I'm just going to have you turn side to side for me. I'm sorry. Good. And then bend at the waist. On the other side. Good. All right. And no pain or discomfort when you do that?
No.
Okay. Go ahead and have a seat back here for me. And I'm going to check your spinal accessory muscles. I don't believe I did that. I can't remember if I did that. So we'll do it again real quick. Go ahead and look left and look right for me. Look up and down. Good. Good. Shrug your shoulders. Good. And then we're going to do it again with some resistance. This is testing her cranial nerve 9 spinal accessory. Go ahead. There you go. And look the other way. Yep. Go ahead. And look down. All right. And then shrug your shoulders for me. Good. Okay. So I'm going to recap real quick. Just the cranial nerves, I think. One would be the olfactory, which we would have tested if we think there's something wrong or she's got some issues with smell. Cranial nerve 2 is the optic nerve. That's with the vision test that we've done. 3, 4, and 6 are the ocular motor, trochlear, and the abducens. That's when we did the fields of gaze, the cover on cover, and looked at her eyes and did the eye test. And 5 is the trigeminal. That's the light reflex that we did on her face. 7 is the facial nerves. That's the wrinkling of the head, the puffing of the cheeks. And let's see. 8 is the acoustic. That's when we did the Weber-Wren test and the whisper test. 9 and 10 are the glossopharyngeal and the vagus. That's when she did her swallowing and her sticking out of her tongue and her gag reflex, rather. And then the 11 is the spinal accessory muscle. So I missaid that one earlier, misspoke. It's 11 is the spinal accessory muscle. That's when we tested range of motion, passive and aggressive. And then finally the number 12, the cranial nerve 12, is a hypoglossal. And that's the sticking the tongue out and making sure it's midline, which we did earlier as well. So I think that we've covered everything. And that would conclude Clarissa's head to toe. Thank you.